Hi everyone, I'm Dr. Vanilla and I welcome you to Raaonline.co.in. It's amazing that a lot of medical syndromes and pathology that we learn in medicine and practice and try to manage are a huge conundrum of symptoms, and they often are like a tip of iceberg that we see in clinical picture, but a lot more underneath. And pregnancy and hypertensive disorders are a typical example of our iceberg phenomenon. Here we have a very complex scenario of a pregnant woman with a raised BP and a compromised baby who may or may not have proteinuria but has a generalized edema. But underneath this, what you often see, there is a huge surge of catecholamines that's actually affecting the entire body system. And this is the interesting topic that we're going to go on today. So how are pregnancy and hypertension connected? It's a very unique and challenging syndrome. The basic pathology of this disease itself works against the whole basics of pregnancy, i.e. trying to supply blood to the baby. So the uteroplacental flow gets compromised and the baby is affected, and in this process the mother is also affected. So it is not a very good situation. Pathology and treatment have to be measured. You need to have a close eye on the mother so that you can actually provide the treatment because of the effects of the drugs on the mother and the fetus. So what's the global incidence of this phenomenon? It's quoted as high as 3 to 8% in pregnancies all over the world, peaking in America, which is where most of the statistics is from. However, our national health portal in India says that the incidence can be as high as 8 to 10%, and 1 to 2% of them can actually have a severe preeclampsia or eclampsia. This kind of correlates with the statistics in the rest of the part of Southeast Asia. This has significant morbidity and mortality, and it's henceforth very important as an anesthetist to understand the basic pathology, physiology of the process and how to manage and prevent problems in this patient. PIH spectrum by itself is a wide spectrum of diseases, starting from only having hypertension to adding on with excessive symptoms with end organ damage to one of the worst scenario of having eclampsia. So it could be chronic hypertension in a lady who's already hypertensive or has a tendency towards hypertension, or with a superimposed gestational hypertension. Or this could be a lady with only gestational hypertension who returns back to baseline postpartum. She could have preeclampsia, which is a syndrome in itself, where you have hypergestational hypertension with end organ damage. And eclampsia is when there is central nervous system involvement and she actually has a seizure.